Welcome back. In this session, we are going to discuss another homeopathic remedy called Artemisia vulgaris. The common name of Artemisia vulgaris is mugwort. You can see in the picture here Artemisia vulgaris. Artemisia, like any other artemisias, this remedy has a prominent place in convulsive diseases. Artemisia vulgaris, like other artemisias, we have other artemisias which we will be discussing in the next videos. For now, let us focus on Artemisia vulgaris, which has gained a popularity in curing the convulsive diseases. It occupies a prominent place in our materia medica in treating the convulsive diseases. It is a principal remedy for conditions like epilepsy, epilepsy and catalepsy. Catalepsy is what? Catalepsy is occurs when the patient, you can see here, when the patient goes into a state of rigidity, all the muscles will become very rigid and he stops responding to the external stimuli. When the muscles go in a state of rigidity, not responding to external stimuli, it is known as catalepsy. Spasmodic twitchings as seen in chorea. So in the chorea, when there are abnormal involuntary muscle like contractions, when they have abnormal movements of the body, involuntarily these abnormal movements are occurring, then it is termed as chorea. Chorea, there is also spasmodic twitchings. As we see in chorea, we have the spasmodic twitchings. Hysterical fits, we have fits which are hysterical. Eclampsia. So what is eclampsia, people? Eclampsia occurs in pregnant women when the mother is subjected to hypertension, albuminuria along with the convulsions. Then it is eclampsia. And convulsions of the various types, such as it occurs in hydrocephalus and teething. So convulsions which are occurring in hydrocephalus and during the teething, during the dentition in children, then when they throw convulsions, we can think of Artemisia vulgaris. Moving further, the main indication is in epilepsy. From your exam point of view, Artemisia indicate Artemisia vulgaris in epilepsy could be the probable question. So we see epilepsy is after a fright or grief or a bad news. So what is the causation for the patient to throw the fits or undergo convulsions? It is because of fright, emotional disturbances, grief, bad news after a blow on the head. A man can throw convulsions after masturbation and with menstrual discharges in the women and teething in the children. So guys, what is the cause? So far, what are the causes we saw? That is fright, grief, bad news. Fright, grief and bad news. A blow on the head. After masturbation in men. After menstrual disturbances in females or teething in the children. Attacks are frequently repeated. So we see the epileptic attacks are repeated, which is followed by a long interval of rest. So if the patient gets epilepsy, so here the patient got epilepsy, then again he goes back into a state of rest, followed by the next attack. Okay, again there is an attack of epilepsy. So the attacks are frequently repeated. We see the repetition of attack followed by the long interval of rest. Several attacks of epilepsy in the same day, and this epileptic attacks, the several attacks we saw, are occurring in the same day. They are occurring on the same day. Epilepsy without aura. This is important. How is the epilepsy in Artemisia vulgaris? The epilepsy is occurring without any aura. There is no prior symptoms. There are no prior aura present in cases of Artemisia. Attacks are accompanied, the epileptic attacks are followed by the profuse offensive sweat and by seminal ejaculations in men. After epilepsy, a man may be subjected to seminal ejaculations in man and profuse sweat after an epileptic attack. Fever is associated with the profuse sweat having a peculiar fetid, cadaverous or garlic-like odor. Cadaverous is the smell which we get from the dead bodies, which is rotten, completely decayed. So such odor is known as cadaverous. Cadaver, the dead body, we get that smell when we go to perform the autopsies, and we see the autopsies. During that period, we observe that characteristic cadaverous smell from that dead body. So the patient has this cadaverous smell, putrid smell, fetid. Okay, like garlic like odor is a characteristic of this remedy. Very important. The profuse sweat. What is the odor of the sweat? Odor of the sweat is cadaverous. It is cadaverous, fetid. It is fetid, cadaverous, garlic like. Okay, moving on to the mental symptoms of artemisia. Stupor is followed by convulsions. So we have the stupor. The patient is in a stuporous state. When he is in a stuporous state, later on he can throw convulsions. Somnambulism, you see, when the patient is walking at night. Somnambulism during sleep. When the patient walks during sleep, it is somnambulism. Inclination to steal. We have kleptomania, a rubric, kleptomania, where the person has a desire or an inclination to steal. Catalepsy is induced by bodily exertion. You see, the desire to steal. And we also have catalepsy. Catalepsy, I told you, the body is in a state of rigidity, not excited, not going back to the normal state even by any sort of stimuli, doesn't affect. So the effects are because of the fright. We can also take effects of fright, grief, bad news in cases of the mental symptoms. Moving further to the particulars of artemisia. Epilepsy, the causation is a fright, grief, bad news, the blow on the head after masturbation, after the menstrual discharges, teething in the children. So before epilepsy, there is no aura present, there is absence of aura. So you see the causation here, grief, all that, and teething in the children. The baby can throw convulsions. Now we are seeing how is the epilepsy in detail. Epilepsy is occurring without any aura. During the attacks, they keep repeating frequently, and it is followed by a long interval of rest. I have explained you this in the guiding symptoms. So once we are very sure of the guiding symptoms, the particulars become very easy because we just have to apply the same points here. After the attack, the patient is having a very profuse offensive sweat. How is the sweat? Cadaverous smelling, garlic like sweat. Okay, garlic smelling sweat. And in men, there is seminal ejaculations after the epilepsy. Moving on, during the epilepsy, what happens? There is eyes which are turned upwards. That is important. And the half of the eyes are open and they are drawn upwards. And there is pain and blurring of the vision. In relation to the epilepsy, we saw that they will be half closed and will be turned upwards, which we will discuss in the next slide. Here they are saying that eyes generally, they have pain in the eyes, blurring of the vision. You can see the patient feels there is blurring of the vision, and he feels better when he rubs the eyes, and they become worse when he uses the eyes. Once the patient uses the eyes, he studies for a long time or works on the laptop for a long time, does some work, and then later after using his eyes for a prolonged period, he has this pain and blurring of the vision, and when he rubs the eyes, he feels better. The colored light is producing dizziness in the patient. So guys, what are the eye symptoms in artemisia? We have blurring of vision, better by rubbing and worse by using eyes. And we have colored light. The colored light, if the patient sees the colored light, he feels dizzy. Teeth, the grinding of the teeth. In the teeth symptoms during epilepsy, we have the grinding of the teeth. The froth at the mouth, thumbs drawn into the fist. So we see in the mouth, there is froth which is coming from the mouth, and the thumb is drawn into the fist. You can see the fist of the patient. The thumb will be drawn into the fist. Eyes are half open and drawn upwards. You can see in the picture here, the eyes of the patient is half open and drawn upwards. Mouth, the patient bites the tongue in spasms. When he throws the convulsions, during the spasms, he bites the tongue. The speech is unintelligible, can utter but a single word. He can utter the words, but he utters just a single word, and also with a great exertion. Even the single word will be exerted with a great difficulty in the patient. Moving further to the face, there are twitchings in the face. The mouth is drawn to the left side. So we see the twitchings are seen on the face and the mouth is drawn to the left side. The face looks oldish. The patient has a face which is very old. He feels the premature aging. The face will be prematurely aged. He looks old. The lower jaw is pressed forward. When he throws the convulsions, the biting of the teeth, and the lower jaw will be protruded outwards. There is jaw being pressed forwards. Chewing motion of the gums and the grinding of the teeth. They have this chewing motion of the gums and they grind the teeth. Okay. In the face, we saw twitchings of the face. Face looks oldish. Lower jaw will, when they are grinding the teeth, you can remember like this, grinding of the teeth and protrusion of the lower jaw. Chewing motion will be observed in the gums. Moving further to the female complaints of Artemisia. There is profuse menses and violent uterine contractions. The patient observes spasms during menses. There are spasms during menses, violent uterine contractions, and the menses are very profuse. Irregular or deficient menstruation. Either the menses could be profuse or irregular or deficient menstruation with epileptic convulsions. So during menstruation, they have epileptic convulsions during menstruation. Violent contractions of the pregnant uterus. Because of the violent contractions of the pregnant uterus, it can also be subjected to threatened miscarriages. There is a possibility of abortion or miscarriages. Checked lochia. Okay, miscarriage when it is occurring before a certain time limit, and once it crosses 5 months, we consider it once the baby weighs more than 500 mg, it is abortion. So let's not go into the OBG part. So we see that there is threatened miscarriages. Checked lochia. The lochia is checked in the patient. There is no proper flow of the lochia. Eclampsia of the sucklings. So the sucklings, the infants can throw up the convulsions. Then we also have eclampsia seen in the sucklings. Okay. Moving further to the male sexual organs. Male sexual organs, we have the nightly pollutions. They have nightly pollutions, which is nothing but the seminal leakage. Involuntarily excessive seminal leakages. Seminal ejaculations with the spasm. Along with the spasm, they have seminal ejaculations. And we saw that after the convulsions, the patient have involuntary seminal ejaculations. So this is all about the Artemisia vulgaris. I hope the remedy is clear. If you have any doubts, feel free to put them down in the comment section. And if you like the video, don't forget to hit the like button and subscribe.